Hello, and welcome to Boomer and Beyond Wellness. I'm Angela Fischetti. So today we're finally going to be doing part 2 of mobility of the hip joint. And the accessories we'll be using are pretty simple. We have a yoga mat, we have a ball, also yoga blocks. And for those of you who have never used them, well, we have level 1, level 2, and level 3. Also, we'll be using a yoga strap. I'm particularly fond of yoga straps for us in our age group because, let's face it, some of us have arthritic hands, some are dealing with trigger fingers or Dupuytren's contracture, what have you. So these are soft. But the other great thing about a yoga strap is that it's 6 to 8 feet in length and really useful for a lot of different stretches as well as postures. And let's see, and well, a chair. Now, I know you're gonna think I'm crazy, but I'm gonna go there with you. I need the chair to be armless and without wheels, folks. I want you holding steady with the working on a flat surface. So a little bit of going into the medical disclaimers, but one we need to tackle immediately. Some of the equipment, like the mat, the ball, they're made out of latex. So if you do have latex allergies, you want to look for non-latex or latex-free. Now, the other medical disclaimers. Well, if you've ever been diagnosed with any back spine issue, particularly if you've been told no bending down, no forward flexion, all right? You need to stay upright for this class. If you're medicated or not for hypertension, which is high blood pressure, vertigo, GERD, if you've ever had a TIA, transient ischemic attack or a stroke, if you have carpal tunnel syndrome, pinched nerve in the neck, and rotator cuff issues, that would be like deep within the shoulders, and knee issues. So what I'm going to ask you all to do to please pay attention to the modifications and suggestions I make during the session. I'm also going to invite all of you to please preview the video first and, look for what you can do. Let's face it, at our age, and if we have chronic issues, we're really good about knowing what we can't do, and that's smart. But now let's broaden the vision, broaden the perspective, and look at this from the perspective of, well, let me look now for what I can do. And that's how you get stronger, folks, and that's how you get more flexible. But if you're still questioning, if you're not sure after previewing it, then I would invite a medical healthcare practitioner who knows your body best to preview the video as well to help you make an informed decision. Now, we're going to be moving right into the work. However, well, I would like you to learn how to sit in a chair and what I'm looking for from you. I'm going to turn a little bit to the side, and I'll be moving the chair around a little bit, but I'm looking for your ankle, knee, and hip joint. This is the coxal joint, the acetabulofemoral joint that we're going to be focusing our attention on today. But when you sit, I'd like these to all be in alignment with each other because oftentimes, folks, people sit like this with their heels way back. Well, if you have knee issues, probably those knees are not going to feel pretty good after you've been sitting like that. So bring your feet a little bit forward and plant the feet into the ground. The other thing I'm going to suggest is place your hands underneath the buttock flesh. Pull the flesh not only straight back, but out wide toward the shoulders, because now I'm sitting up and forward on the front edge of the ischial tuberosity, the ischium, one of the pelvic bones affected by the hip joint. And in yoga, we refer to these bones as the sits bones. Now, this class, well, this is going to be, I don't know, it's a combination of a little bit of yoga, a little bit of stretching, a little bit of strength. But the word mobility tells you that we're going to send love to the joint. Flexibility is muscles, mobility are joints. So here we go. We're going to begin here with movements of the spine because I just think it's a delicious way to begin. So placing the hands on the thighs. Now I'm going to begin to slide the hands up toward the top of the thigh. Present the chest, roll shoulders back. And I'm coming into a little bit of a back bend here, lifting the chin. However, Those of you who have had a transient ischemic attack or a stroke, you keep your head neutral. Do not drop your head back. The rest of us can drop the head back. So this is spine extension. And on the exhale, those of you with back spine issues, you come to neutral while the rest of us work into spine flexion. It's like we're doing a seated abdominal crunch, drawing that belly button in, letting the head go. Hypertension, vertigo, GERD, you need your head up. You're not going to drop the head down. Inhale, we come into spine extension. Take your time. Exhale into spine flexion. Inhale, spine extension. Exhale, spine flexion. And we're going to hold in that flexion. Please just hold right there. Get a sense of that transverse abdominis, the deepest of the core muscles. Just flow that belly button. Pull it in toward the small of your back. And then we slowly roll on up. Let's take a couple of nice big shoulder rolls. Now I'm going to turn my chair again. And I want you to see a little bit from a kind of like a diagonal. I'm sitting forward on the chair. Now, those of you with back issues and spine issues, you may need to have support behind you. So you can use a yoga bolster or a pillow or a cushion. But I want you upright, not slouching in that chair. So from here, because in life we have so much forward flexion, I want to emphasize now back extension, right? So we want to bring the hands behind us. This is a classic yoga chair, folks, so it can just slip through. Now, I'm going to scoot forward and look at that hand. That is contraindicated for carpal tunnel syndrome. No matter the position of the arm, wrist extension is contraindicated. So you grab a hold of the side or the seat as long as you're not extending the wrist. Now from here, I'm going to do that again. I'm going to puff up the chest, roll shoulders back. So what happens here, which is fantastic, is scapular retraction. Shoulder blades kind of sliding down and in toward each other. Remember, TIA, stroke, no lifting of the head. The rest of us can. A little bit more back, spine extension. Breathing in and out through the nose. And then slowly come back to center. I'm going to turn back here straight forward for you. Next one is lateral flexion. So I bring the feet a little bit wider apart, holding on to the outer right leg of the chair, left hand to the waist. I'm going to slide down, turn the sternum toward the ceiling, present your heart. What we don't want is collapsing the right side organs down toward the floor. Now, if you have any kind of left shoulder restriction, pinched nerve, you want to keep your hand to your waist. Otherwise, you start to bring the arm out, up, and over. Now, maybe you don't have real issues, but you're just kind of tight in the shoulder, and this is your range of motion. That's fine. Keep the elbow straight. I'm not a big fan of this, and people think they're going over further. You're not, and your shoulder may not appreciate it, okay? So just go to your range of motion, turning the sternum up, reaching up and out through that left middle finger while pushing down into the left heel, breath in and out through the nose. It's a delicious stretch for the waist, the oblique muscles. Turning and twisting the waist is their responsibility. Inhale, turn that palm up, grab a hook, push into that left foot, vigorously reach out to the side. Exhale, return to center, and grabbing the outer left leg of the chair, I slide down, right hand to waist, rotate sternum towards ceiling. This is my tighter side. Boy, do I feel it, but it feels good. Even if I just kind of hook my arm back, feels really great. Sternum toward the ceiling, arm up and over. What else are we stretching here? Those beautiful intercostal muscles between the ribs. They're responsible for 25% of the respiratory cycle. That's why whenever I do this lateral flexion, side bending work, I want to breathe. Now inhale, turn the palm up, grab a hook, press into the right heel, exhale vigorously, reach out, come back to center, take a couple of shoulder rolls. Now on this next one, we're going to tie in rotation. It's called a soupy grind. Those of you with back spine issues, you're going to keep your movement small. That's what I'm doing, just kind of moving the bowl of the pelvis. That's about it. And you would take it in both directions. For those of you who want to go a little wider, bigger, go for it. And here we go, soupy grind. So what's it doing? It's kind of combining all of the movements we just did of the spine. But now we start to introduce hip abduction, ABD, going away from the midline of the body. I'm going to reverse direction. Later we'll do it even bigger. You go as big or as small as you need with the movement. Stop and rest whenever you need to. Stay hydrated with water, folks. And hold here. I'm going to roll it up, belly button in, and then toe, heel, the feet a little bit toward each other. Now I'm going to grab my ball, bring it out in front, hip abduction, ABD. Knees are going to track over the second to third toe, belly button is in. I'm going to give a little bit of an adjustment again to the buttock flesh. Now, with the ball, I don't care how big, small, whatever you want to work with, but what I do care about is for back spine, when we're working on the spine flexion work, you're working on pushing down, use your fingertips to lift and lengthen. That's what I want you to work on, those erector muscles along both sides of the spine. So here we go. I'm just going to walk the fingertips out. I keep the head up. So especially for hypertension, medicated or not, vertigo and GERD, you keep that head up, please. Now, for some, if you want to drop the head, fine, but be careful. That usually leads to a rounding and a collapsing of the spine. I don't want that version of an abdominal crunch here. Now, you can hold out there with the fingertips, head is up. So if you want to get into some areas of the back, just roll the ball over and, oh, it's great. Breathing in and out, nice stretch for the latissimus dorsi, that big swimmer's muscle, for the quadratus lumborum, that low back. Take it over. Push those thighs open, push down strongly into your feet. And keep the breath in and out through the nose. And then we'll take it back to center one more time, maybe a little further out in front. The more I press those thighs back behind me. Head is up. And now with the belly button in, it's as if I'm lifting the chest forward and up to roll back up to center, grab the ball, toe, heel, the feet toward each other. Very nice movement for your ankles. The next one I'd like to do now is introduce the use of the block. So what we're going to do is I'm going to sit a little forward here, and I'm placing the block between my knees. Now, what often happens, I want you to see the feet fully. So what often happens when people sit in a chair and they use the block, they do this, or they do this. So no, let's go ankle, knee, hip, but also pretty much no wider than the width of the block. Squeezing, because now we're working on the concept of hip adduction, ADD, all part of that hip joint and the mobility. We're pushing in. This is working more from an isometric strengthening perspective. Now, left hand goes to the outside of the right thigh. For those of you with back spine issues, in particular postural deviations and osteoporosis, but not limited to them, all right? Right hand onto the outside of that hip joint, the coxal. aka acetabulofemoral joint. Hold here. Lengthen the spine, inhale. Exhale, you folks take a small movement, just roll the shoulder back, that's it. But for the rest of us, right arm up, inhale, roll shoulder back, really exaggerate the movements in yoga. And I'm grabbing a hold of the chair. Exhale on the twist. Breath in and out, squeezing the block. Now, while I have you hold here, I want to remind you to go back and review part 1 of mobility of the hip joint, so you can learn a little bit more about the anatomy, what's going on there. Breath in and out, draw the belly button in as much as you can, make space for the twist. Don't let the power of the arm take over to crank you into the twist. Let it come in internally. Inhale, head forward. Exhale, torso, arm back to center. Just let's take it to the other side. Inhale, exhale, inhale, rotate. Push down into both feet for spine length. Exhale, twist. Rolling shoulder back. So make sure that block doesn't fall away from you. That means you're not working those adductor muscles, those inner thighs. Keep pulling the belly button in, chest is up. And then inhale, turn the head forward. Exhale, torso, arm back to center. I'm going to remove the block, set it down for the moment. Now from here, I want you to interlock the fingers underneath your right thigh. If you're medicated for hypertension or not, you've been told not to squeeze the fingers, just place one hand on the other. You can also use your yoga strap underneath your thigh, folks, to help you lift the leg. Now, when I go to lift, push down on the left, ankle, knee, hip alignment, to lift the right. Belly button is in, hold here. Breath in and out through the nose. Now we're in hip flexion, folks. I'm not inviting you to slouch. I'm inviting you to sit up. Now, maybe this is your hip flexion for today. That's okay. It's fine. And if you really have the flexibility and mobility, placing the foot on the chair, I'm going to wrap my elbows around, push down on the left to sit tall, and really hug it in. Be careful of this movement if you have questionable knees, right? You want to keep I like to work with hands behind the knees for my people with knee issues. Got to be careful on hyperflexion for you folks. Breathing. And then I'm going to release and I'm going to shift a little forward in my chair. And now I want to do a hip rotation. Do you need to touch the floor with your toes? No, that's okay. Hip rotation, get into that joint. And now I'm going to reverse direction. By the way, I've seen people do this. Don't do that. Please sit up tall and only work to the degree that you can handle. So if it's a small movement, that's acceptable too, you know. And one more, hold here. Now we're going to do medial and lateral rotation. So medial rotation is internal rotation. Lateral rotation is external rotation, all from the hip joint. I know you might think, well, I'm doing it from my knee or ankle. No, I'm not. They're going along for the ride. This is coming from the hip joint. And I look at this and visualize a sideways number 8. I'm doing a sideways number 8 to get both medial and lateral rotation. Let's do one more of each. It's really nice to do these movements because they also help to release the back and set the leg down and to shake out your hands, flick your fingers if you need to, flap the wrists, and then interlock or not underneath that left thigh, push down in the right to lift the left. And we're working on what? Hip flexion. Hold steady here. And then if you have the mobility and joint mobility and muscle flexibility, you can hug it on in. Pushing down on the right to sit tall on the left. Breath in and out. Hip flexion. Of course, you can always work with that bolster behind you on the chair. You need help in sitting upright. And then I'm going to release. And now coming into rotation. So folks, I live in South Beach, and no matter what time of the day or night I film, there's going to be noise. You might hear mufflers, you might hear some music. I can't control all that. It's out in the street. So I hope you have patience with that. One more. Reverse. Just know that you're massaging the joint through movement. Make sure that belly button is pulled in as you're sitting in that chair. One more. And now, medial rotation, lateral rotation, medial rotation, lateral rotation. Sideways, number 8. So some people are in a wheelchair, yes. Some people have to sit in a chair for countless hours at their jobs. Chair's not an enemy. Find how you can make peace with your chair, because it's a wonderful tool for movement. One more. And then set it on down. Shake the hands out. Flick the fingers, flap the wrists. All right. Now I'm going to sit back into the chair. I think what I'm going to do is try to get that thing out of the way. Yeah, that helps. And I'm going to move over a little bit. And let me bring this over as well. So now, I want you to hold on to your chair. I don't care where you hold on, all right? But just hold on to the chair. I'm going to lift the legs up. Make up a little crooked here for you. So there we go. Yeah. All right. So legs up. Now I want to show you something. When I point down, that's called plantar flexion. When I go like this, that's called dorsiflexion. So I'm drawing the dorsal part of the foot up toward your face. So both legs are out in front. If you have a back issue, please support yourself with a bolster or a cushion, pillow. I'm stretching the toes nice and wide apart. Now I'm going to tie in a little bit more of a strengthening component for hip abduction, ABD, going into hip adduction, ADD. Hip abduction, hip adduction. Keep going. Now, can you do this with your knees bent? Sure. You can slide the feet along the floor. Why not? Are you breathing? Now, sometimes if somebody's exercising and they have a form of COPD, you're going to need to do pursed lip breathing, right? So you want to look into that as well for chronic obstructive pulmonary disease. Keep that chest up, no collapsing. And of course, those quadricep muscles get worked here as well. The shin muscles are getting worked. We're lengthening hamstrings and calves. Notice I'm not going super wide. There's a smaller muscle surrounding the hip area called the tensor fasciae latae, and that little bugger likes to take over, but it becomes kind of debilitating when it works too much. So we want to make sure that we don't go too wide apart here. Last one, drawing in and bend the knees down, lower the feet. I'm just going to tap out the feet a little bit. Now I'm gonna come into a real wide-legged, soupy grind. Oh, feels great. First off, let's go for the stretch of those adductor muscles, pressing the legs open. So remember, soupy grind, what we talked about before, back spine. Who's gonna go narrow? Who can feel free to go wide? And I'm gonna reverse direction. Release that back, hips. Coming back to center, holding here. Toe, heel, the feet. I'm gonna grab both blocks. Putting them out in front. Now, folks, I use stuff that I use all the time when I work out. So some of it's gonna look worn. It's because I put it to good use. So I'm gonna bring the sides of the feet on the blocks. Just let it go. What is this? Lateral rotation of that hip joint, right? Lateral rotation. We allow those adductor muscles to ease up. I don't want to see this. Yes, I'm inviting you to relax into it, but please don't slouch. So let's make sure we don't slouch. We're going to open the arms out, and I'm going to lean back, and I'm going to use my chair to help me come into a back extension. Remember, TIA stroke, head neutral. Don't drop the head back, please. Now, folks, just because I caution those with pre-existing issues doesn't mean doing the work is going to bring on the issues. Let's be clear about that. Breathe. Stretch the pectoralis muscle, the front delt, the anterior neck muscles. It's fabulous. Biceps. And then we're going to self-hug. And I'm going to sit up tall. I'm not even sitting back into the chair, reaching the fingers in between the scapulae, the shoulder blades. And I'm going to rotate the spine. I call it rock the baby in a self-hug. And then we reopen, self-hug, opposite arm on top, and rock the baby. And then relax the arms down. Let's bring the hands underneath the knees, slowly draw the knees together. Now, folks, you can choose to stay here with your feet up on the blocks. You can lower to one block, you can lower to the floor. But it will help if you use the blocks for those of you with the back spine issues, because I want you to use the strap or your hands to help you lift that foot. So here we go. And then you can work like this. All right. Now I'm going to get rid of the strap and show you what I'm going to do. I'm going to get rid of the blocks. I'm just going to do this from the seated position, but I have to come a little forward in order to be able to do it, right? So I'm going to grab a hold, peace fingers. It's called yogi toe lock, peace fingers. They're wedged between the big and the second toe. I push down on the left to lift the right. What is it? Hip flexion. Inhale, exhale. So now we're getting all that posterior thigh and leg. Even the fascia, the connective tissue underlying the foot, all stretched out. Achilles tendon, calf, hamstring, glute. What I'm doing here, you'll see it now when I bring it out into what? Hip abduction, ABD. Notice that my right bicep is flexed because the elbow is flexed. And so I don't want to do this. I want to bend it and use that bicep, push down on the left foot, extend out through the right for hip abduction. Then I come back to center. The return to center is hip adduction, ADD. You want to go beyond the midline, you can. Now the left hand grabs the outside edge of the right foot. I'm going to go straight on here. Inhale the arm up. Exhale, back spine. You're bringing that hand to the outside of the hip. You're not going any further than that in your twist, right? The rest of us can really turn and twist. Looking over the right shoulder, pushing out through the right heel. Pulling. with the strong left arm, pushing down in the left foot. So we're adding a rotation. Breath in and out through the nose. And then inhale, head forward. Exhale, I'm going to crisscross both. Bend the knee again, hip flexion. Push down here, left foot. Inhale, exhale, push out through the right heel. Bend the elbows. Woo. Big old stretch in that hamstring. Oh, Lordy. And breathe. And then rebend the knee into the chest. I'm going to go on an angle here for you a bit. Ooh, I felt that. So yogi toe lock, peace fingers, man, right? That's my generation. And now we take a hold of the big toe, down into the right to lift the left. Inhale, here's that hip flexion. And exhale, extend out in front. Get that bicep involved, folks. Don't let this stuff happen. Pull from the bicep. That's how I want you to carry your groceries too, by the way. You bend the elbows. Don't let the arms just hang out like that. Get that bicep involved. Put it to work. Hold here. So this is called Hasta Padang Bustasana, hand to big toe pose. There's different ways of doing it. And then you can hold onto the chair, onto your waist, arm out, whatever you want. We're going to bring it out into hip abduction. Hold. Try not to lean over to the side. And then we come in toward the midline, abduction of the hip. And if I want to go across, which I do because I have issues in this glute and I want to stretch them out even more. Hold here. Now remember, those of you with the back spine issues, you're not going any further than your left hand on the outside of your left hip bone. I'm going to go back to center. Inhale up. Exhale. I'm going to bring that arm in behind the chair. Roll shoulder back. Big stretch in that left glute as well. Pull with that right bicep. Push down in the right foot to lengthen and lift tall in that chair. Breath in and out through the nose. And then inhale, head center. Exhale, crisscross wrists. Back to your hip flexion. Inhale. Exhale, extend that leg out. Pull from the biceps. Lift the chin. I'm not asking you to drop your head back. Just lift the chin. Eyes beyond your toes. Gaze beyond your toes. It's called your drashti in yoga. It's a little factoid. And now we bend the knee toward you to set the foot down. Let me turn the chair again. Oh. Tap out the feet. Now, what I'm going to do is move my chair forward this way because behind me, I want clearance, all right? I'm going to scoot out to the side of the chair. Hold on. Don't do this. Scoot out and then fall, right? Hold on, okay? So the back of the knee of the chair, the seat, is right up against the back of the knee closest to the wall to my side. Now, I'm going to lift up onto the ball of the outside foot. Slide it back, hand on the chair, lift that chest up, and now I have a beautiful hip extension. Other extensor muscles would be the gluteals, the back muscles, and the quadricep on the anterior side, posterior side would be glutes and extensor muscles of the spine, or the back, I should say. So that's a way you can do it. Now, folks, if you can't get your leg all the way back, that's all right. It's a variation on a posture in yoga called Anjaneyasana, crescent moon. You can vigorously reach the arm up. Now, if you feel confident, you push down in that front foot and bring the opposite arm up. Extend, reach back. Watch it with TIA and a stroke. No head drops back. And then inhale, hands to the heart. Hold on. Exhale, slide the foot forward first, then scoot into the chair. We're going to turn around and take it to the opposite side. I know you know where I'm going with this. It's all about just clearing my surface, make sure that my circumstance, I should say, make sure it's safe, right? So I scoot out on the chair. The back of the seat, the edge of the seat is behind my knee, holding on to the chair. And I'm going to lift on the ball of that outside foot, slide it back. I push down here because I'm looking to have a little bit of a back extension also in the work. So it's just fantastic. It stretches those hip flexor muscles. Stretches all of them out, which is great. You might even feel it in that quadricep muscle, front of the thigh. And maybe arm up, maybe opposite arm up, maybe interlock. Now watch this kind of arm position if you have a pinched nerve at your neck. I wouldn't do this position, I would keep it wide. And then inhale, hands down, hold on to the chair before you move. Exhale, slide the foot in, scoot back onto the chair. And just one last movement, one last position I want to show you here. Let me grab my blocks and I'm going to bring them out in front, stacking them one on top of the other. And I'm going to bring both hands. You know what? I'm going to turn to the side for you. I think this is going to be a better view. All right, so we're going to go here. I've been known to change my mind. And I'm going to put the heels up on the blocks. I'm going to point the feet down. I'm going to hold on to the chair. Thrust the chest up. Roll shoulders back. Lift the chin. Variation on Matsyasana, fish pose in yoga, but it is definitely an extension of that whole posterior side. I'm lifting my seat just a little bit to stay in your seat if you're not used to doing this. And then inhale, chin toward the chest. Exhale, slowly lower down into the chair. And that's what we have for you today on Boomer and Beyond Wellness. Folks, if you would like the content, I would surely appreciate it if you could subscribe to the channel, maybe give it a thumbs up, even a sweet kind of comment, maybe share it with some people who can benefit from the information. Until next time we meet, make sure to keep yourselves hydrated. I'm a whole food, plant exclusive person, so I'm going to tell you to eat your greens, eat your beans, and until next time, be well. Thank you all so much.